Hello, Aaron. This is Representative Casey, Chairman of the Health and Human Services Committee. You're here to testify on House Bill 6015. You have our attention. If you could please keep your testimony to 2 minutes. Thank you. Go right ahead.
Great. Thank you. Good evening. I want to thank the committee for allowing me to testify in support of House Bill 6015. My name is Erin Dutho, and I'm a resident of Burrillville, Rhode Island. I'm here showing support as the chapter leader of Freedom Keepers United Rhode Island, a global organization advocating for informed consent, medical freedom, and bodily autonomy. But most importantly, I am representing myself as a single parent of 2 young children, one of which has special needs. I've spent many hours inside the walls of hospitals, specialist offices, and pediatricians. Our pediatric visits often include a quick 5-minute visit with the doctor, followed by 1 or more immunizations per the CDC recommended childhood schedule. These typically follow a pattern of doctors stating that Johnny is getting X, Y, and Z shot today, vaccine is then administered, and then as a parent, I'm helped a brief information sheet that goes through minor side effects that may occur. There's no conversation, there's no mention of where to find manufacturer inserts and ingredients of these immunizations, or how to report any adverse reactions. In fact, prior to doing my own research, I wasn't aware that any of this information even existed. How can parents and patients provide informed consent to immunizations and other medical procedures without understanding the full spectrum of risks and benefits before administration? Providing true informed consent is the right of every patient. For the American Medical Association, I quote, patients have the right to receive information and ask questions about recommended treatments so that they can make well-considered decisions about care. The Code of Medical Ethics states that it's the physician's responsibility to document the informed consent conversation and the patient's decision in medical record in some manner. Please join me in support of House Bill 6015 and allow all patients accessibility to this information to encourage trust and open dialogue with their physicians. Thank you for your time.
Thank you for your testimony, Aaron. Are there any questions from the committee? Okay, we're going to go on to our next witness. Thank you. Hello, Christine. This is Representative Casey, Chairman of the Health and Human Services Committee. You're here on House Bill 6015. You have our attention. Could you please keep your testimony brief? Go right ahead.
I will. Good evening, Chairman Casey and members of the committee. Thank you all so much for your service to the people of Rhode Island. My name is Christine Healy-Waldeck. I'm a Rhode Island parent, and I'm co-founder of the Rhode Island Wellness Society. I stand in strong support of this House Bill 6015. Thank you so much, Representative Price, for sponsoring this legislation. The purpose of this very important bill is to protect the informed consent ethic and to ensure that Rhode Islanders are giving informed consent for the medical procedure of vaccination. Currently in the state of Rhode Island, there are no vaccine consumer protection laws. There are no vaccine-related informed consent laws, and there are no standard informed consent forms for the medical procedure of vaccination. Our Rhode Island Department of Health considers the use of vaccine information statement sheets, or VISs, to be, quote, best practice for immunizing patients. This practice, unfortunately, is very ineffective because vaccine information statement sheets do not contain enough information for Rhode Islanders to make informed decisions regarding vaccination. Looking back at our own experiences, as well as considering the experiences from other families around the state, vaccine information statements are not properly given, nor are clearly displayed in all healthcare provider offices. Many parents whom I've spoken with have never even heard about them. Many offices simply keep VISs, the vaccine information statements, laminated and on a metal ring on a desk in the exam room. And by doing so, it's the bare minimum. However, they are in compliance with CDC requirements. Besides the fact that many vaccine providers do not even properly review VISs with patients, the unfortunate reality is that vaccine information statements, which are written by the CDC, are woefully inadequate and lack very important vaccine product information. On the other hand, there are documents called vaccine package inserts, or VPIs, which are written and made by the vaccine manufacturer for each individual vaccine. These vaccine package inserts are inserted into the vaccine vial box and can be easily assessed online on the FDA website and vaccine manufacturer's website. The differences between vaccine information statements and vaccine package inserts are like night and day. While VISs are very vague, very brief, and do not delve into all of the documented adverse events, the vaccine package inserts provide much more detailed and comprehensive vaccine product information. For example, on the VIS sheets for an inactivated influenza vaccine, the side effects listed are very limited. However, on a vaccine package insert, the patient can read all about the vaccine ingredients and excipients, all post-marketing data, and much more. For example, a vaccine package insert for a Fluzone quadrivalent flu vaccine manufactured by Sanofi Pasteur. On page 40, you will learn that mercury-containing thimerosal is used as a preservative in the multi-dose vials. In section 6.2, you can read about the very important post-marketing data. These are documented severe adverse events that have happened after the vaccine was introduced into the market and more people were vaccinated. Some of these documented adverse events post-vaccination were blood and lymphatic system disorders, immune system disorders, eye disorders, nervous system disorders, convulsions, encephalomyelitis, transverse myelitis, tissue disorders, gastrointestinal disorders, to name a few. In section 8.1, you can read about how there is insufficient data regarding the use of flu vaccines in pregnant women to inform about vaccine-associated risk of developmental outcomes.
Ms.
In
Waldeck?
section 3,
Ms.
yes,
Waldeck?
sir.
Okay, you've gone over 5 minutes. If you could please just try to wrap it up for us right now.
I will. In closing, I implore the committee to please protect our right to know all vaccine product information, and please help protect the informed consent ethic. Please help advocate for the repeal and reform of the 1986 Childhood Vaccine Injury Act and the PrEP Act to help make vaccine manufacturers and providers liable again for harm and deaths that their vaccines can cause. Please ensure transparency by requiring vaccine providers give a copy of the vaccine package insert to vaccine recipients prior to vaccination, and please require providers give a copy of a Rhode Island Vaccine Consumer Safety Informed Consent Form or a similar document and obtain written consent from the vaccine recipients. I've submitted written testimony and example documents for the committee's review. Please support 6015 and please bring it to the House floor. Thank you so much for your time and for your consideration.
Thank you. Thank you. Is there any question from the committee regarding this testimony? Okay, we're going to move to our next witness. Thank you.
Thank you.
Okay. Hello, Amy Gardner. This is Chairman Casey from the Health and Human Services Committee. How are you tonight?
Hi, good, thank you.
Good. Could you please turn down any listening device you might have on the other end there? And I would like to give you 2 minutes to do your testimony on House Bill 6015. Go.
Okay, thank you. I don't actually have any listening voice near me. So, my name is Amy Gardner. I'm from Southern Rhode Island, and I'm in full support of this bill. I just don't think there's any reason not to support a bill which is supporting informed consent for the public for any other pharmaceutical product. It's literally mandated for TV commercials or any kind of advertisement that every single contradiction be listed. But when it comes to a vaccine product, it is only a VIS statement currently required, which only lists a portion of those contradictions, which doesn't give the consumer the ability to have full informed consent as to what they're saying yes to. So I feel this is a straightforward thing that supports the citizens in being able to know what choices they are making.
Thank you for your testimony, Amy. Are there any questions from the committee? Okay, if not, we're going to move on to our next testimony. Thank you.
Thank you. Have a great night.
Okay. Hello, Carol. This is Chairman Casey from the Health and Human Services Committee. You're testifying here on House Bill 6015. If you would please keep your testimony to 2 minutes, go right ahead.
I will, sir. Thank you so much. Thank you so much for allowing me to support Bill 6015. The only way that people can give their informed consent for immunization is if they're able to weigh the risks and benefits for themselves. How could they possibly weigh these risks if they are not assured access to the data that the passing of this bill would ensure? There are always risks that come with receiving vaccinations. If death, especially, is ever written in an insert as a possible side effect of a vaccine, there's no question that to not pass this bill could be the ultimate and unintended disregard for human life. Informed consent means you're being honest with the public. The paragraph that's been added to this law, 4 points in this bill, is responsible, ethical, humane, and utterly necessary. I can see no reason, no rational reason why it wouldn't be passed. It serves to protect your constituents and ensures transparency. This bill is especially crucial in light of the National Childhood Vaccine Injury Act of 1986, in which vaccine companies were granted indemnification, shielded from any responsibility for death and adverse reactions caused by their products. This bill provides a crucial step in protecting families from potential future physical, emotional, and financial harm. This bill is especially needed and timely. People simply have to have all the data, ingredients, contraindications, side effects, etc., before they consider taking a vaccine, especially a new one. For the CDC, there are nearly twice as many vaccine-related deaths so far in 2021, 1,755, and I think that might be last week's number, than all the vaccine deaths this past decade, 994. By passing this bill, you can at least rest assured that you've allowed people to see all the pertinent data needed for them to do their own risk analysis. The rest will be up to the consumer, but they need to have informed consent. Thank you so much for your time and so much for your support. Thank you.
Thank you very much, Carol. Are there any questions from the committee? Okay, we'll take our next witness, please. Hello, Ms. Jennings. This is Chairman Casey from the Health and Human Services Committee. You're here on House Bill 6015. If you would keep your testimony to 2 minutes, we would appreciate it. Go right ahead, please.
Thank you. My name's Deborah Jennings. I'm a registered nurse. I live in Middletown, and I think this is the 5th year that many groups in Rhode Island have been addressing this issue of informed consent, and it really needs to go forward. And there just has to be a greater clarity and consistency in the messaging to promote this a better transparency, so there's understanding. The vaccine package insert, I think, is essential, and the lot number and the manufacturer. Yeah? So I've got some interference.
I'm sorry, go right ahead.
My concern today is what's happening with the vaccines that people are receiving right now, the messenger RNA vaccines and Johnson & Johnson's new vaccine, which is actually genetically engineered DNA. These have not been approved by the FDA. They're on emergency use authorization. There's no long-term safety study. There's animal studies. The animals have not been where they've been subjected to the wild virus, the wild coronavirus, which has in the past shown hideous results. Those were not done in these studies. We're using genetically engineered components. These are not traditional vaccines in any sense of the word. This is an experimental biotechnology that's being introduced on the population, the global population. And it's right on Moderna's website that they're really introducing an operating system into the body that's virtually going to hijack mechanisms within our immune system. and our whole being as humans. I'm horrified because my girlfriend just got one of these and she was given no informed consent. She just said, no, everybody was very courteous, but they were just running them through. That's a travesty. She had no idea what she's getting into. I've talked to a lot of Rhode Islanders. So we're a little late in getting a consistent informed consent out there. I just wish there was some way we could unroll time, but we can't. So I wish we had just moved forward, and so we don't have to repeat these errors. There has to be full disclosure to the citizenry, and safety is my biggest concern. The virus reporting system from these vaccines, it's a nightmare. It's a nightmare what's happening. Sorry, I'm being passionate.
Okay, well, I appreciate your passion, and thank you for your testimony. Are there any questions for the witness at this time? Okay, we're going to move on. Thank you, Deborah.
Thank you very much.
Okay, for the record, there was a Michelle Kirby. Did you try that number? Okay, so for the record, there was a Michelle Kirby who was opposed to the legislation. The phone number that was given was dialed, and we called a couple of times, and the person is unavailable. So I will read to you the list of written testimony. Let's see here. Okay, everyone is in favor of the bill. This is Grace Toppy, Kimberly Lanawi, Caitlin DaCosta, Kate Merriweather, Deborah Z. O'Leary from the Rhode Island Alliance for Vaccine Choice, Kendra Walsh of the URI, she's a URI Pharma D candidate, Linda McBride, MSN and RN, Daryl Gomes Hidalgo, Hida Gardner, heartdream@AOL.com, Madalena Sirignata, she was a first witness, Ellen Schaefer, Rhode Island Wellness, that's Christine Healy-Waldeck, she was one of our witnesses. Rhode Island Department of Health, Dr. Alexander Scott submitted a letter regarding, this was not for or against, but regarding the Rhode Island Department of Health best practices. You can all read that in the written testimony. Adriana Bonilla is in favor, and then a company called Bio, and Ben Chandhawk is against this legislation. So are there any other comments or questions from the committee at this time? Representative Kassar.
Yes, thank you, Mr. Chairman. And I just want to kind of go on the record to make sure that we all understand that informed consent is not necessarily just the distribution of an insert from a product, as was suggested by a number of our witnesses today. I have in front of me the vaccine information sheet for the MMR vaccine, as well as the vaccine information sheet for the diphtheria, tetanus, pertussis vaccine. And just to make sure we understand what exactly is already provided, there were some references during our testimony that some providers have these vaccine information sheets hidden. My eldest child is turning 21 next month. I have received one of these at least every time that my children have been vaccinated. I know that the pediatricians in our state are extremely responsible and are very responsive for any individuals who have doubts about vaccines. The reasons why they support vaccines is because this is a way to reduce the risk of injury, disability, and death in our children. And I would like to make sure that our record for this committee shows that vaccines are one of the major public health successes over the past century. They have prevented death. They have prevented significant illness. And I support what we are currently doing. I think getting a 2-page information sheet for most families is more than they have time to read when they have small children. But these sheets include why children are getting vaccinated and people are getting vaccinated, what the product is about, how they can communicate with their healthcare provider, the risks of vaccine reactions, what they can do if there's a problem. It talks about VAERS and, as was mentioned by witnesses, and the injury compensation program. And the inserts that were requested are all available online, as many of our witnesses have shown. So thank you for the time, Mr. Chairman, and that is all.
Thank you. Go ahead, Representative Fogarty.
And just to add, that absolutely every time my children have been vaccinated, I've received one of the VIS sheets every single time. And also that the doctors make sure that they have always put in the charts. They have it, I know my pediatrician had it on the wall, what vaccine maker was being used that day, what the lot number was used that day, and it was put right into the patient's files. They keep very good track of that in case there is ever a problem, and that rarely ever happens. Even the vaccine manufacturers have made it so that even on a single dose syringe, that there's a peel-off label that has the lot and the manufacturer number that sticks right onto the chart to even make it easier and make sure there's no transcription errors by the nurse when putting it in the charts, just for a little extra added information. Thank you.
Thank you, Representative Fogarty. Are there any other comments from the committee? Okay, that will close the hearing. Did I get the bill number? 60. That'll close the hearing on 6015. We're going to move to Representative Giraldo's bill, and Vice Chair Donovan will take over at this point. Representative Giraldo, you go ahead and introduce your bill.
Thank you, Mr. Chairman, and members of the Committee on Health and Human Services. I'm before you today to ask for your support of H6079, an act that would prohibit discrimination against a potential organ transplant recipient based solely on a physical or mental disability. Specifically, an individual who is a candidate to receive an anatomical gift would not be deemed ineligible or denied insurance coverage solely based on the individual's physical or mental disability, except to the extent that the physical or mental disability has been found by a physician or surgeon to be medically significant to the provision of the anatomical gift. And the origin of this bill is an interesting one. It was my former wrestling coach's son, a high school student, who was interested in doing a school project on the rights of those with Down syndrome and or those with who are differently abled. He was interested in the subject as his brother, Isaac, was born with Down syndrome. As he was doing his research, he uncovered some concerns, which I'll describe in a moment, in coordination with the National Down Syndrome Society and Autism Self-Advocacy Network, created the basis for H6079, the bill you see before you here today. Specifically in his research, he identified that the state of Rhode Island has not further strengthened or defined into Rhode Island law the portion of the ADA, the Americans with Disabilities Act, which vaguely speaks to the anti-discrimination protections for the differently abled when being considered for organ transplants, therefore leaving the investigative and determinative process rather murky and prohibitively lengthy. Establishing the specific regulations and protections and avenues for what my bill would do would be to establish the specific regulations and protections along with the avenues for an expedited injunctive relief highlighted in 6079, and would enable a more transparent and fair process, and would also ensure a swifter enforcement and compliance in these critical time-sensitive situations. The National Council on Disability, in a report to the President in 2019, states that while rarely invoked in this context, the Americans with Disabilities Act and Section 504 of the Rehabilitation Act prohibit organ transplant centers from discriminating on the basis of a disability. But limited enforcement is likely due to the time-sensitive nature of organ transplant decisions and the fact that federal litigation can take years to resolve. The lack of federal guidance may also contribute to the lack of litigation under federal anti-discrimination laws. And so although federal and state laws ban organ transplant discrimination, people with disabilities are often denied equal access to organ transplants because of discriminatory assumptions that the lives of people with disabilities are of poorer quality than those of people without disabilities, and due to misconceptions about the ability of people with disabilities to comply with post-operative care. So what does this bill do to clarify and strengthen the language in the ADA? It prohibits discrimination by medical providers. It requires consideration of all the support networks available. It requires reasonable modification and auxiliary aid to be taken into consideration. It prohibits discrimination by insurance carriers and provides for a quick resolution. Specifically, it includes a fast-track procedure for challenging discrimination to ensure that people in urgent need of an organ transplant can obtain timely resolutions to their discrimination claims. And I think it's important to note that nothing in this bill may be used to require a medically inappropriate organ transplant, and that no right to compensatory or punitive damages against a covered entity is created in favor of a person who has been subjected to the prohibitive discrimination. This bill is supported by the Commission for Human Rights and the Rhode Island Developmental Disability Council, as well as many others, and they've submitted written testimony for you to consider. And so, ladies and gentlemen of the committee, we unfortunately live in a world where organ denials are based on disability rather than suitability. And I ask you in joining me in the notion that receiving an organ to save your life should never be jeopardized because of the fears, myths, and/or stereotypes about one's disability. So I thank you again, members of the committee, for your time and consideration of this bill. Thank you.
Thank you, Representative. Are there any questions for Representative Giraldo? No? Okay, we'll go to our first caller. Hello, Mr. Marshall. This is okay, never mind. Hello, Mr. Marshall. This is Vice Chair Donovan. You're testifying. Hello, Mr. Marshall. Three the charm.
Hello?
Oh, hello, Mr. Marshall. There you are. You're testifying.
Have a good time then.
Yeah, you're testifying on Bill 6079. You can proceed.
Okay, I'll be very brief. I know you've been here a while. The Rhode Island Developmental Disabilities Council obviously supports all efforts to reform some of the past practices that have led to discrimination for people with disabilities in the healthcare field. We find this bill to be a good move in that direction. We would, however, suggest a sub-A to remove the solely piece of this. The disability should not be considered at all in making these decisions. As was mentioned by the sponsor, if there's a problem with the person's ability to do the post-op care, then that will be adjusted just the way it would from the EU non-disabled people. If you can't do it, you can't do it. But the fact that you're disabled should not come into play, and so we would ask that the word solely be removed 7 times in the bill where it implies that. So with that, I'd be happy to take any questions.
Thank you, Mr. Marshall. Are there any questions for this witness? No. Okay. We do have written testimony in favor of this bill from the Rhode Island Commission for Human Rights and, of course, the Rhode Island Developmental Disabilities Council. Okay. Are there any more questions for Representative Giraldo? Oh. Okay, we will close the hearing on Bill number 6079. And the next bill we're going to hear is Bill number 6078 by Representative McGaugh. Representative, are you there?
I am here.
Okay.
Hi. Thank you, everybody. Thank you, Representative Donovan, Vice Chair Donovan, and thank you to the committee for your time. This bill, H6078, is a resolution respectfully asking Congress to pass a single-payer healthcare system that would provide universal, comprehensive, and affordable healthcare to all Americans. How many of us have been asked to attend a fundraiser to help a friend or a family member raise money to pay for treatment of a debilitating illness? How many of us have donated to a GoFundMe page because someone we know is trying to find a way to pay their doctor and their hospital bills? We heard testimony earlier about colon cancer patients and the importance of early screening. Imagine that those cancer patients are not only fighting for their life and trying to do all they can to get well, but now have the added challenge of organizing fundraisers and asking the people they know for money so that they don't have to lose everything that they've worked for. In talking with people across my district and across the state of Rhode Island about access to healthcare, I hear story after story about people's challenges with affordably accessing the care that they need. I hear the stories of people delaying care, people skipping care that they need at the detriment of their own health. I also hear about people that did receive care only to be riddled with costs that leave them financially devastated. We're fortunate here in Rhode Island that we have a high insured rate, but even at our highly insured numbers, it is still estimated that more than 40,000 Rhode Islanders are not insured. Add to that the estimated 45% of Rhode Islanders, about 450,000 people that are estimated to be underinsured, saddled with high deductibles and copays limiting their access to the services they need. Enter COVID-19. In a society where our health insurance is tied to our employment, suddenly at a time when we need health insurance the most, we find record numbers of Rhode Islanders out of work and therefore losing their coverage. For those that do seek care, we need to recognize that 2/3 of personal bankruptcies are healthcare related. 3/4 of those had health insurance. Every other industrialized nation in the world offers universal health care to its citizens and enjoys better health outcomes for less than 2/3 to a half of the cost. Those countries recognize that how much money you have should not make the difference of whether you live or die. Delaying care, skipping care, bankruptcy for seeking care, it doesn't have to be this way. The system we have is not working. For that reason, expanding Medicare, where a universal health care system has widespread support across the country, with an estimated 2/3 of voters supporting such an initiative. It has the support of 635 union organizations. Here in Rhode Island and across the country, the development of a universal health care system would help not only individuals, but also benefit small businesses. Right now, our small businesses bear the cost of a growing healthcare expense. The need to constantly reevaluate this expense, to implement those changes, and the challenges of competing with large employers' benefit packages require significant time and resources of our small business owners. Consider also our local cities and towns and the challenges they face with unfunded liabilities, such as other post-employment benefits, the OPEB benefits, which include health insurance. What positive impact would a universal health care system have on the cities and towns we represent if this significant component of their budget was provided through a universal health care system? We can join other industrialized nations across the globe in providing better access to care for the benefit of our families, friends, our neighbors, for our small businesses, and for our municipalities. This resolution asking Congress to pass a universal, comprehensive, and affordable health care system is a small step in improving the lives of Rhode Islanders and of all Americans. And with that, I'll take questions.
Thank you, Representative McGaugh. Any questions from the committee? Yes, Representative Potter.
Thank you, Madam Chair, and not a question per se, but just a comment if I can. First, thank you, Representative McGaugh. Very important legislation. Really proud to support it and happy to be a co-sponsor of it. But one of the things that Representative McGaugh mentioned that I think we should just take a second to swing back to is how she referenced that, earlier tonight we heard testimony about insurance companies not providing coverage for colorectal exams, right? And it wasn't just that. We also heard testimony that Chairman Bennett next to me also brought up people who are forced to leave a hospital earlier than they should. And then we heard testimony about insurance companies not providing coverage for breast exams when there might be, the indication that that could pose a later health complication. And, the common denominator between just so much of the legislation that we've heard proposed and the issues that we've heard in this committee this year, but especially tonight, is that we have a system that does not prioritize the care of patients, but it prioritizes the profits of corporations. And, as important as a lot of these pieces of legislation that we have heard are, and how optimistic I am that they can be impactful, there's overwhelming evidence that the only way that this problem, this crisis that we have, is ever going to get fixed is when we move to a single-payer system. So I would just, one thing that Representative McGaugh, I don't think mentioned, is that the leading cause of bankruptcy in this country is because of medical debt. I mean, that figure, that statistic alone should be jarring to anybody who hears it. And I would just remind the committee that our counterparts in the Senate have already passed this legislation. It passed on the Senate floor. And I think it would be really impactful for the House to also follow suit. So it would be my desire that we support this and hopefully move it out of committee sooner rather than later. And I look forward to a full vote on the floor. So thank you, Madam Chair.
Thank you, Representative Potter. Are there any questions for Representative Potter? Okay. We have written testimony submitted, all in favor. Kendra Walsh, Sister Mary Prendergast, Kate McGovern, and Jordan Goyette. We can move on to the verbal testimony now, the first caller. Okay. Hello, Jack.
Hello.
Jacqueline, could you turn off your computer?
Yes, I just did. I'm sorry.
Okay, thank you. You are testifying on bill number 6078. You can proceed.
Fabulous. Thank you so much to the members of the House Health and Human Services Committee, and especially to Representatives Donovan, Kassar, and Potter for sponsoring this legislation. I do hope that you push it out of committee and put it onto the floor. My name is Jacqueline Goldman. I am an epidemiologist, but more importantly, I'm a person with a body. Like everyone else, I have some healthcare story about times when I could not access care because I did not have sufficient insurance. I was an AmeriCorps volunteer for 2 years, where I was given insurance that hardly covered anything. And so even though I was only making $1 an hour, I was still on the hook for extraordinarily high medical bills. So I've experienced this firsthand. And the thing is that right now in Rhode Island, about 50% of people are underinsured, and I think about 40,000 people don't have insurance at all. This resolution shows that this is a priority for our state, and that this is something we should consider further, and not just look at for the state level, but at the federal level. That's all I really have to say. So thank you so much.
Thank you, Jacqueline. Any questions for this witness? Okay, thank you, Jacqueline. We'll move on to the next caller.
Thank you.
Okay. Hello, Mr. Robinson?
Oh, yep, that's me.
Yes, this is Vice Chair Donovan. You are testifying on bill number 6079. You can proceed.
Thank you. Is it 6079 or is it 6078?
78, sorry, put my glasses on.
No, it's totally cool. I'm sure it's been a long evening. I'll be brief. I am in favor of this 6078, which would looks like it would urge the United States Congress to pass legislation establishing Medicare for all. I love the first line of the bill where it just says that health care is a human right, not a commodity available to only those who can afford it. It's not right that people's health depends on their wealth, essentially. And I'll just use a quick kind of example here locally in our state here in Rhode Island. A couple days ago, Rhode Island's largest health insurer announced that it was abandoning a plan to start charging its members for out-of-pocket costs for COVID-19. And the reason that they abandoned that plan was because it's shameful that people would be charged for medical care for a once-in-a-100-year pandemic. And I just think that Medicare for all would just completely eliminate these issues completely. And so this is why I'm in favor of this. And I know it's passed the Senate, and I really think it'd be great if it could pass this committee and for a floor vote. And so I appreciate everyone's time and consideration, and I hope you all have a good night.
Thank you, Mr. Robinson. Do you have any questions for Mr. Robinson? No. Okay, thank you for your testimony.
Take care.
Okay, we'll go on to the next caller. Okay. Hello, Mr. Sanchez?
One second. Wait.
Yes, this is Vice Chair Donovan. You're testifying on Bill 6078. You can proceed.
Yes, thank you. Hello, members of the committee. Thank you for having us here and having members of the Rhode Island community speak. I am here. My name is Enrique Sanchez. I am here representing the BLM PAC and Providence DSA, Democratic Socialists of America. I am here in support of House Bill 6078 that would urge our federal delegation to pass Medicare for all, to support Medicare for all at the congressional level. I asked our federal delegation, Senator Whitehouse, Senator Reed, Representative Sicily, and Representative Jim Langevin to think about this entire process of the pandemic that has wrecked people's lives economically, psychologically, emotionally. Hundreds of thousands of Americans have died. Thousands of Rhode Islanders have died. This pandemic has brought pain and suffrage to many Rhode Islanders. And now that the pandemic is still in our lives, the economic impact is showing. Thousands of Rhode Islanders won't be able to. Thousands of Rhode Islanders who were contaminated with COVID have thousands of dollars mounted and medical bills. Medicare for all would solve the issue of this problem for a lot of Rhode Islanders. Not every Rhode Islander, working class Rhode Islanders, don't have the privilege of going to a clinic or a hospital or a doctor and not having to pay a cent or a copay or get a copay sent to them. So at the end of the day, the majority of Rhode Islanders would want our federal delegation to push for Medicare for all. It's not that difficult. It's a demand that we here as working class Rhode Islanders want. We want our federal delegation to take into consideration the impact of this pandemic and what it has done to thousands of Rhode in the last year and a half. So I urge our federal delegation to support Medicare for all, and I look forward to whatever our delegation ends up in support of. Thank you.
Thank you, Mr. Sanchez. Are there any questions for Mr. Sanchez? No. Okay. Thank you for your testimony.
Thank you. Bye-bye.
We'll go on to the next caller, and we have quite a bit of callers tonight, so if you could please limit your testimony to 2 minutes, it would be great. Thank you. Okay. Hello, Anita. This is Vice Chair Donovan. You're testifying on Bill 6078. You can proceed.
Thank you very much. I deeply appreciate this opportunity to testify. My name is Anita Keston. I have both a medical degree and an MPH degree from Brown University. And like you, I need health care, as do my family and friends. I'm here to speak in favor of the bill because I believe that we need to do everything we can in Rhode Island and in Washington, D.C. to promote the only rational solution to the gaps in our medical system, which COVID has so clearly exposed. Throughout my career, I have taken care of many vulnerable patients, and of course with COVID-19, I worry much more about how these people will receive effective medical care. Single payer can alleviate some of the barriers to care experienced by people in who are vulnerable, and I urge the committee to pass this bill. So I'll give a few examples. For the man living in poverty to whom I handed a prescription for a drug that could prevent a stroke, but who never filled the script because he had no insurance and could not afford to pay for the medication, single payer could prevent a stroke. For the woman referred to me with bruises due not to a bleeding disorder but to violence in the home, single payer could remove a critical barrier to an escape for her and for her children because she would no longer fear losing health insurance for her family by escaping. For the person addicted to opiates after back surgery and no longer employed, single payer could enable them to access evidence-based medication-assisted treatment. And for the homeless person with untreated mental illness, single payer could render treatment accessible and reduce the risk of incarceration. Single payer would have a beneficial effect on lowering both economic and healthcare disparities. However, even people with jobs, homes, money, and health insurance stand to gain from single payer. People who work in a toxic work environment would be free to pursue other employment opportunities, free of the fear of losing health insurance. People who dream of starting a small business would no longer be deterred by the fear of losing health insurance or the daunting challenge of providing coverage for their employees. As others have mentioned, many unions support this. And finally, this would benefit our hospital ecosystem. In Rhode Island, for example, as a result of the closure of Memorial Hospital, a friend encountered an overwhelming ER when she presented with a vascular catastrophe, and as a result, she did not receive the time-sensitive care she needed. Single payer can eliminate hidden costs of care, confusing choices, bankruptcies, and mountains of paperwork for patients, office staff, and doctors. Clinicians could actually focus on providing care and not on filling out forms. That would be wonderful. I personally would love my own doctors to be able to be focused on medicine, and I'm guessing that you would wish the same. Single payer offers great benefits to all of us, and I strongly believe that this is the ethical step we need to take now. This resolution is the least that we can do for our children and our grandchildren. Thank you very much.
Thank you, Anita. Are there any questions for this witness? Okay, thank you for your testimony. We'll go on to the next caller. Okay. Hello, Mr. Sicoscio. This is Vice Chair Donovan. You're testifying on Bill number 6078.
Hello?
Yes, you can proceed.
Hi, my name is TJ Sicoscio. I am testifying as a resident of Warwick, Rhode Island. Firstly, I would like to thank all the House representatives in this committee who have sponsored this bill. This will go a long way towards the effort of single payer, both in Rhode Island and federally. And also, I would like to take a minute to thank my Senator Jeanine Calkin for proposing the same bill that was in the Senate that passed out of committee that I also testified for. I think these bills could do a lot in spreading the message to the federal government that single payer is the option. In 2019, Health Source Rhode Island said that 30% were underinsured. Insurance is inadequate for 43.4% of U.S. adults, ages 19 to 64. And furthermore, 2 out of 5 working age adults were underinsured in 2020. Piecemeal insurance and GoFundMe pages are not the answer. So I would just like to say that I urge this committee to push this bill out of committee and onto the floor and further to the federal Congress. Thank you so much. Have a good night.
Thank you, Mr. Sicoscio. Are there any questions for this witness? Okay, thank you for your testimony. We'll move on to the next caller.
Thank you. Have a good one.
You too. Hello, Dr. Ryan. This is Representative Donovan. You're testifying on Bill 6078. You can proceed.
Thank you very much. Good evening. My name is Mark Ryan. I'm an internist who's practiced in Rhode Island for more than 30 years. I'm also the current chair of the Rhode Island branch of Physicians for a National Health Program, a national organization of more than 20,000 doctors who advocate for a single-payer Medicare for all national health insurance program. I am speaking to support House Resolution 6078, and I would like to thank you, Vice Chairman Donovan, as well as Representatives Kassar and Potter, who are co-sponsoring this bill with Representative Michelle McLaughlin. I'd like to tell a story to begin with of two different patients who have encountered our healthcare system recently. One was a physician who rather unwisely decided to jump off of his own deck and ruptured his right quadriceps muscle. He needed surgery virtually immediately, within 3 days. He got it and was presented with a bill for a $2,000 copayment out of the $2,900 fee for the entire procedure. Fortunately, having a physician's income, he was able to pay the bill. This is in contrast to a person I heard about in the residence clinic that I precepted at last week, a woman who has a much lower paying job who fell and fractured her left hip, the socket, the acetabulum. She was able to bear weight on it, but she could not walk very far, was in terrible pain. That $2,000 copayment that the doctor was able to pay, she was unable to pay, and so was unable to work. She is in threat of losing her job, and her hypertension and diabetes, which she previously had kept under very good control, are now out of control. The purpose of the bill is merely to urge our federal delegation to work vigorously to pass Medicare for All, which all of them, except for Senator Reid, have already said they support. The need for this is clear. Our healthcare system is collapsing. We can see this very clearly in Rhode Island, where our hospitals are financially unstable. West Philly Hospital was bought by Yale New Haven Medical Center because it couldn't afford to keep operating. Roger Williams General Hospital and Fatima were purchased by Prospect Medical Holdings, a California company which has been cited in its home state for health and safety violations. And the two chains, Lifespan and Care New England, have posted losses, forcing them to try to merge to stay afloat. Medicaid cuts forced the closure of Memorial Hospital in Pawtucket, whose patients, who are sometimes referred to as, quote, an unfavorable payer mix, end quote, are now going to receive their care at Merriam and Rhode Island Hospital, bringing their financial burden with them. And now we hear Zambarano, the only chronic care hospital in the state, is going to close. We can afford the most expensive healthcare system in the world, but we cannot afford the poor care that it delivers. It's not only unaffordable to the state of Rhode Island and to the country as a whole, being more than twice as expensive than any other system in the world, it's not affordable to people, and it doesn't deliver good care. A woman giving birth in the United States is 4 times more likely to die in the act than she is in Canada, and 10 times more likely to die in the act than she is in Australia, both countries that have national health insurance programs. The life expectancy of Americans at birth is among the lowest in the industrialized world and stays the lowest until age 65, when miraculously American life expectancies begin to rise until, if an American survives until she's 90 years old, she has the second longest life expectancy after the Japanese. Our system delivers poor care. It does so at the greatest expense. As has already been mentioned, it's the #1 cause of medical bankruptcy, which I'd like to add does not occur in any other country. It kills people, not only because it delivers poor care, but because it fails to deliver care. My example, the lady with the hip fracture, is at high risk for developing pneumonia, pulmonary emboli, and other complications because she can't get her hip fixed. And indeed, we know that the mortality rate of not having insurance in the United States is roughly 1 per 1,000 per year. With 30 million uninsured, 30,000 of our fellow citizens are going to die this year because we can't fix this problem. The alternatives to Medicare for All that have been proposed, the public option, the Medicare for All wanted, won't work because they can't achieve savings in administration and drug costs that Medicare alone can achieve. The waste in our system, estimated at 1 out of every $3 that's put into the system, goes to excessive pharmaceutical company profits and insurance company paperwork and overhead. At Mass General Hospital in Boston, there are more people in their billing department than there are beds in the hospital. An equal-sized hospital in Toronto, Toronto General, has 3 people in their billings department. It's time that we start spending our healthcare money on actually taking care of people and not wasting it to bolster up the profitability of pharmaceutical companies among the most profitable companies in the Fortune 500 and wasting money with insurance company paperwork churn. I urge this committee, I urge the House to consider this bill and please very much to pass it. Thank you so much.
Thank you, Dr. Ryan. Are there any questions for Dr. Ryan? Okay, thank you for your testimony. We'll move on to the next caller. Yes. Hello, Linda. This is Vice Chair Donovan. You're testifying on Bills 6078. You can proceed.
Thank you, Vice Chair. This is Linda Ujifuza. I am co-chair of the Rhode Island Healthcare Access and Affordability Partnership, an affiliate of Physicians for National Health Program. Many thanks for hearing my testimony in support of H6078. There is overwhelming, undisputed evidence showing single-payer Medicare for all is the only means of achieving universal, affordable, comprehensive health care. And I would urge you to go to www.pnhp.org for those details. I'll offer a different perspective tonight for those who still want to leave it to the free market to solve our health insurance woes, and it is this. Health insurance is different from other types of insurance and therefore cannot be treated as a product and must be treated as a public good. Why? Difference 1. You know how much the replacement cost of your house or car is and the likelihood of an accident, but no one knows in any given year what your health care costs will be. You might have a $50 sore throat or a $500,000 case of leukemia. Difference 2, not everyone is going to make an auto or house insurance claim, but everyone has a body that will get sick or hurt someday. Difference 3, you can pretty easily get car or health insurance anytime, but you have to wait for open enrollment periods for health insurance. Why is that? Because if you allowed people to buy health insurance whenever they wanted, they would wait until they thought they were getting sick. And even though that seems smart, if you were to buy house insurance right before you were going to burn it down to collect insurance money, that's called arson and fraud. Since health insurance is nothing like sustainable car and house insurance, it is unsustainable. No business can survive insuring sick people. Insurance companies must cherry pick the healthy and wealthy and lemon drop the sick and poor. So we must not think of health insurance as a product, but rather a public service to protect ourselves from a risk which we all face. And that is how we think about military defense. And we are all much more likely to get cancer, diabetes, or COVID-19 than to get attacked by a foreign terrorist. So please, pass this bill out of committee, as the Rhode Island Senate did, and ask our federal government to pass Medicare for all single payer. We already pay for it because we pay about twice what other industrialized nations pay per capita for health care, and they have universal comprehensive coverage with better health care options. So we already pay for Medicare for all single payer. We're just not getting it. Thank you so much.
Thank you, Linda. Are there any questions for Linda? Okay, thank you for your testimony. We'll go on to the next caller. Okay. Hello, Linda Eibel. This is Vice Chair Donovan. You're testifying on Bill number 6078. You can begin.
Yes, hi, thank you. My name is Linda Eibel. I'm testifying in support of House Bill 6078. I'm a Providence resident and a family practice nurse practitioner. I work in a federally funded community health center that provides care for underserved communities, including many people who are un- or underinsured. Tonight, you've heard testimony on a bill that would require insurance coverage for colon cancer screening. And yet, when the ACA was passed in 2010, it actually mandated colon cancer screening without any out-of-pocket costs to the patient. But as soon as the ACA was enacted, loopholes were sought and exploited by insurers, which should have been expected in a profit-based healthcare system. I've actually had several patients decline colonoscopies even when they had symptoms of colon cancer because of the fear of medical bills that were unaffordable. Primary care providers spend countless hours on the phone trying to get medicines or tests covered and know full well that the default for many insurers is simply to deny coverage and then make it so cumbersome, convoluted, and frustrating to appeal the decision that we give up. The system hasn't just failed consumers of healthcare, it has failed providers of healthcare who are buried under reams of paperwork and the toll of the time and energy spent arguing with insurance representatives whose job it is to simply say no. Whenever I write a prescription, I'm aware of what the out-of-pocket cost might be, often spending time checking the Walmart $4 list and the GoodRx discount website. Pharmaceutical companies have savings cards and patient assistance programs, but the fine print tells you that people who are uninsured are excluded. Some patients now come in requesting hard copies of prescriptions so they can order medicines from Canada, because in the richest country on the planet, they cannot afford their medicine. Last week, I saw a patient who declined the blood tests I recommended because her insurance only covers wellness labs, whatever that means, and anything else falls under her $3,000 deductible. She said she used to have good coverage until her husband lost his job and his new employer only offers a limited plan. Another patient lamented the $1,200 ambulance bill she received after her friend called rescue when she literally couldn't walk due to a pinched nerve. Another patient takes multiple medications to manage pain from his severe knee arthritis because he cannot afford the deductible he would face for the knee replacement he needs, and he needs to keep working.
Okay.
And lastly, another woman declined a referral for therapy because she can't afford the $50 specialist copay, and the prescription for an antidepressant was cheaper. People do not want charity. They want to be treated like human beings. They want the care and tools to get and keep themselves and their families healthy, just like millions of people in other countries who do not worry about medical expenses and who do not stay in miserable jobs for fear of losing their coverage.
Okay, Linda,
In the
that's
US
over 3
medical-
minutes. Could you wrap it up? Thank you.
Yep,
Thank
sure.
you.
Sure. The ACA helps our system, but it is not enough. America needs Medicare for all, and I urge you to support this bill and vote it out of committee.
Thank you, Linda. Are there any questions for this witness? Okay, thank you, Linda, and we'll move on to the next caller. Hello, Isabel. This is Vice Chair Donovan. You're testifying on Bill number 6078. Please be brief.
Nope, this is Isabel Wong, a constituent.
Oh, thank you. Okay, you can begin.
Okay. Hi, my name is Isabel Wong. I am 21 years old and I live in Little Compton. I am supporting Bill H6078 because I believe that single-payer Medicare for all is the only way to create a universal, affordable, comprehensive health care program. While I'm only 21, I've interacted quite a bit with the healthcare system in the United States. When I was born, I had a complete unilateral cleft lip and gum. Cleft lips and gums are a very rare form of birth defect, which, if left untreated, can result in eating, breathing, and speaking difficulties. I was in and out of the hospital from age 4 to 13, frequently dealing with nose surgeries, lip surgeries, and even at the young age of 9, a bone graft. However, here's where my story differs from many of those who are advocates for Medicare for all. My parents never had a problem paying for my surgery. Why? Because my father was a government employee, and that he and our family received federally subsidized health care. Our health care is incredible. My family has never had to go without medical treatment, medicine, mental health help, nothing. We are so incredibly fortunate, and we are certainly not any more deserving than anybody else. I am testifying here today because I believe that everyone should have access to health care, the health care that I received as a child and now as a young adult. They're the only industrialized country in the world that does not have universal health care coverage for all citizens. And that's frankly embarrassing. Healthcare is not a privilege, it is a human right. Who I am, who my parents are, how much money I make, all of these things are irrelevant to whether or not I and everybody else deserves healthcare. Rhode Island has a real chance here. I urge you to vote yes on H6078 so we can show Rhode Island and everyone else that we here in Rhode Island care about the health and well-being of all people.
Thank you.
Thank you.
Thank you, Isabel. Are there any questions for this witness? Okay, thank you for your testimony. We'll go on to the next caller. Hello, Mr. Sanchez. You're testifying on Bill number 6078. You can proceed.
Hi, good evening, members of the Health and Human Services Committee. My name is Miguel Sanchez. I'm here as a Providence resident to testify in support of House Resolution 6078. First off, I would like to thank all of the representatives that sponsored this resolution. This resolution, which would urge our federal delegation to pass Medicare for all, is the bare minimum we could do for Rhode Islanders right now, while we are in the middle of a health crisis. I spend all day assisting low-income Rhode Islanders looking to apply for health coverage through HealthSource RI. And to be frank, it is a very broken system that fails a lot of people. For example, a 27-year-old that makes $28,000 a year only has two options for health coverage that are below a $100 a month premium here in Rhode Island, which at first doesn't sound too bad, but then you realize that those plans have deductibles of over $6,000 each, which is outrageous for one person. These terrible health insurance plans would be non-existent. We had Medicare for all here in Rhode Island. Urging our federal delegation would be the first step in accomplishing that. How much money you have in your bank account should not determine if you have health coverage or not. Healthcare is a human right, and we need to start passing legislation that reflects that. Thank you for your time, committee members.
Thank you, Mr. Sanchez. Are there any questions for this witness? Okay, thank you for your testimony. We'll go on to the next caller. Hello, Julius. This is Representative Donovan. You're here to testify on Bill number 6078. You can proceed.
Hi, thank you, Representative Donovan. My name is Julius Ferraro. I'm calling as a citizen of Providence to testify in support of House Bill 6078. Someone mentioned earlier that only 4% of Rhode Islanders are uninsured, but there are a couple of problems with that number. First of all, in Rhode Island, 450,000 people are underinsured. That's 45% of Rhode Islanders who are rationing their own health care and their family's health care because they fear health care costs. And secondly, this may be most important, those numbers are from 2019, from before the pandemic. So those numbers are from before the mass unemployment, mass sickness, and mass death caused by COVID-19. We don't know what those numbers are now, but you can be confident that they're higher. So I think we need to look at that and say that's not a description of a society that's functioning, that's a description of a society that's sort of collapsing, right? So we need to think about a future where society works for everyone. So we as Rhode Islanders can be leaders in creating that society. So I want to strongly encourage members of this committee to vote in favor of passing House Bill 6078, and in doing so to vote in favor of the people of Rhode Island. Thank you so much for hearing me.
Thank you. Are there any questions for this witness? Thank you for your testimony. We'll move on to the next caller. Hello, Lydia. This is Representative Donovan. You're testifying on Bill 6078. You can proceed.
Hi, I'm Lydia Bennett. I'm a lifelong Rhode Islander, and I've lived in Providence's House District 7 for 5.5 years. I support single-payer health care because I have a complex chronic disease called Ehlers-Danlos syndrome. This is a very painful condition that affects every system of my body, and treating it gets really expensive. I need a lot of regular specialist appointments, tests, PT twice a week, and I've also needed major surgery. A team of talented doctors and PTs have helped me address the many complications of this disease, and fortunately, I've been able to return to the workforce. But even with the quote-unquote good insurance, my out-of-pocket expenses are thousands of dollars every year. I've tried to cut back on this by putting off specialist appointments, and sometimes I skip PT, but if I keep doing this, that could mean I develop even more complications down the line, and possibly even need more expensive surgeries and procedures to treat them. I worry even more for other Americans with my condition who do not have insurance at all. I can imagine how much they must be suffering, or the financial burden they must carry. I'm going to graduate from graduate school next year, and I plan to be a social worker in the medical field to give back and help other people with chronic conditions like me. However, one of my biggest concerns when it comes to finding a job is not whether I like the job or the location, but how I'll be able to pay my health care expenses. What good is having my dream job if I end up losing it because a problem I couldn't afford to fix gets so bad it knocks me out of the workforce again? I've even considered moving to Massachusetts because the jobs up there tend to pay more. But if Medicare for all is passed, either nationally or at the state level, I would save so much on health care that I wouldn't have to worry about money so much. This means I could afford to stay in Rhode Island and help people in my community. Thank you for your time. Please support Medicare for all.
Thank you. Are there any questions for this witness? Thank you for your testimony, Lydia. Okay.
Thank you. Have a good one.
You too. We'll go on to the next caller. Okay. Hello, Leah. This is Representative Donovan. You're testifying on Bill number 6078. You can proceed.
Hi, thank you for hearing my testimony. My name is Leah Schumacher, and I'm here to testify in support of the bill. I'm a citizen of Providence. I support the bill because I believe all people should have access to high-quality health care, and that no one should have to either live in poor health or go into medical debt to get the care they need. And I think this bill is a really great opportunity for us to lead the way toward everyone having access to health care. I know it's late, so I'll be brief, but I wanted to share a quick personal story about how expensive healthcare can be. So I'm in my early 30s and I'm generally in good health, but in my mid-20s, I was having daily pain in my leg. I put off going to the doctor for a long time because I knew it would be expensive, and when diagnostic imaging was recommended, again, I put that off because while I had health insurance, I knew it was going to cost a lot. When I finally did get testing, I learned I had hip dysplasia since childhood that hadn't been diagnosed. So as a 20-something-year-old, I actually had severe osteoarthritis in my left hip and needed a hip replacement. So after several years, during which time I had daily pain and had to modify lots of activities, I finally did get a procedure. And I was fortunate enough to have employer-sponsored health insurance. Because of my age and being in good health, I was in the hospital for less than 24 hours, and the bill, had I not had insurance, would have been over $50,000. Even with insurance, it was several $1,000s for less than a day of care. So I very clearly am one of the lucky ones who could get care and could make it work. I encourage you to think about the 400,000 Rhode Islanders who are underinsured and don't seek care and do live in daily pain or have to live with reduced quality of life. Our healthcare system is not working for a vast majority of people. So I just really encourage you to support this bill as a next step toward creating a better way. Thank you.
Thank you very much for your testimony. Are there any questions for the witness? Okay, we're going to move on to our next call. Okay. Hello, Jesse. This is Chairman Casey from the Health and Human Services Committee. You're here on House Bill 6078. If you would keep your testimony brief, we would appreciate it. Go right ahead.
All right, thank you very much. Hello to the members of the Health and Human Services Committee. My name is Jesse Marsh. I'm testifying in support of House Bill 6078. I fully support this bill, and specifically health care that is decoupled from employment. During my time in Rhode Island, I've been the insurance provider for myself and my wife, and for many years I was fortunate to have excellent health coverage through Brown University and Blue Cross Blue Shield of Rhode Island, during which time I was diagnosed with an incurable autoimmune disorder, Crohn's disease, that will likely require treatment for the rest of my life and increases my risk of colorectal cancer. I later changed employers and was covered by Blue Cross of Massachusetts, though the coverage was more expensive and arguably worse due to coding errors and resulting out-of-network bills from Lifespan. I've spent many hours fighting over charges related to infusions and infusion locations, both of which were dictated by the insurance company, and I continue to deal with these issues to this day, attempting to resolve past billing issues once and for all. In my current job, I elected to get the best coverage available to me through my employer, first through Anthem and then through United Healthcare, both of which require significant co-insurance payments that I will easily max out every year for the foreseeable future. Just last week, I paid Lifespan a bill of $2,500, which brings me closer to my personal annual out-of-pocket maximum, but this does not apply to my wife's coverage, and if she were to require unexpected medical care, we have not budgeted for that. I would ask that all members of the committee to consider that I am one of the lucky ones. Despite these hardships, I am fortunate that I will hopefully not be completely bankrupted by medical bills as long as I am able to work, and I am fortunate that I have the resources and the wherewithal to advocate for myself when I receive erroneous bills or high co-insurance charges, which is something that not all patients can do, especially the most vulnerable among us. I urge Rhode Island to push the U.S. Congress in the right direction and to advocate for Medicare for all in the strongest possible terms, and I don't think it's hyperbolic to say that keeping the insurance structure in this country the way it is quite literally putting profits over human lives. I want to thank the members of the committee for taking the time to listen to my testimony.
Thank you for your testimony, Jesse. Are there any questions for our witness? Okay, we're going to move on to our next caller. Thank you very much. Good. Good afternoon, Mr. Lee. This is Chairman Casey from the Health and Human Services Committee. I'd like to welcome you back into our forum. You have 2 minutes to complete your testimony for House Bill 6078. Go right ahead, please.
I'd like to thank the committee for allowing me to testify and thank the sponsors, particularly my representative, David Morales, for proposing something so essential to our state and nation, especially right now. I'm urging you to support this bill. Right now, Rhode Island has the highest rate of coronavirus in the country, which has the highest rate of coronavirus in the world. We are experiencing a relatively slow vaccine rollout. 9,000 vaccines were rolled out this Friday, and while I was searching for vaccines for my asthmatic partner seconds after they were announced, time slots disappeared as I was clicking them. Rhode Island residents, especially the working class, have been put into an impossible situation. This winter, while my partner was facing a potential eviction around Christmas time and my car had several damages, we both had to take multiple jobs in retail just to handle all of our bills together. Despite living in the midst of a pandemic, we were forced to either expose ourselves to coronavirus daily or lose my car and their apartment. This is not just one person's experience. All of Rhode Island and the United States has been living this reality every day for the past year. In the wake of a pandemic that has killed 2,600 people in Rhode Island, or about 3 in every 1,000 Rhode Islanders, we have a duty to our dead neighbors, friends, and family to propose Medicare for all before this becomes an epidemic. I myself am insured, and I can verify that Medicare for all would help me as well. I have been waiting on wisdom tooth surgery for a few months now, which my insurance company keeps putting off. I've been regularly getting headaches, and even knowing it would probably bankrupt me, I'm considering paying for this surgery out of pocket. Aside from this, I've had reassignment surgery on hold for 2 years due to my insurance company not supporting such surgeries unless due to a medical necessity. I have friends who have waited for reassignment surgery for 4 years and are still waiting because their insurance agencies know that we have no option but to wait for them to help us even in emergency situations. I know someone who used to work in health insurance, and he would constantly talk about it in a negative tone, saying health insurance is not health care. His job was designing software that would be able to efficiently deny insurance to people seeking surgery. As an activist, he constantly advocates against the company that he works for, and he's not the only one. This isn't about jobs when the people who are working at these companies feel like they are killing people. If you care about providing jobs, put people to use on infrastructure, public transportation, reforestation, and public housing. Provide work to them by funding research for the cancer that you have so many survivors.
Isaiah, I'm sorry, I got to interrupt you. Can you tell me how any of the things that you're speaking of right now are going to affect the legislation or relate to the legislation?
I've been explaining that this whole time.
Okay. But single-payer healthcare won't solve the problems of infrastructure and those type of things. You're getting a little off topic. I just want you to wrap it up.
I am mentioning those as an alternative to the jobs that you are quote-unquote providing to insurance providers. I am also talking about how there are other options for people to work that don't require killing people, and I don't understand how that doesn't seem to have a relevance, because I've been explaining it very clearly here.
Okay, can you do me can you tell me, do you have any research, you seem to be well versed, do you have any research on what it would cost for single-payer health care in Rhode Island?
It would actually cost a lot less. I don't have any research specifically on the cost, but I do have research on how insurance companies, insurance employees have not been interested in their work and have only been looking forward to their work because of the health care that they access due to it. I have also talked about how 2,600 people in Rhode Island have died due to COVID, and they need health care to be provided to them, which is soon to be denied in insurance companies.
Okay,
Go ahead.
I don't know that the vaccine rollout would be any faster under any other national or statewide healthcare, single-payer healthcare.
I didn't say that it would. I said that healthcare would help the people who are going to be affected by this pandemic, since there are insurance companies who are planning on canceling insurance, canceling free provisions for COVID on April 1st, despite the fact that the vaccine rollout doesn't hit the lowest age ranges until April 19th. And it is very important to provide insurance to the people who get COVID, regardless of whether or not they get the vaccine or whether they have access to testing, which is also important.
Okay. Thank you for your testimony. Are there any questions for Mr. Lee? Okay. Representative McGaugh, I'm going to give you a couple of minutes just briefly to recap, and I would like to pose the question to you if you have any research regarding potential costs for a program of this nature.
Yes, thank you, Rep. Casey. I want to thank everybody for their testimony tonight. Rep. Casey, I believe Dr. Mark Ryan, when he came on and spoke, who is president of the Rhode Island Chapter of Physicians for a National Health Plan, discussed some of the cost implications about that regarding this legislation. What we're talking about here is a resolution asking for a federal single-payer healthcare system. And I think an important point that was brought up during the testimony tonight is that people are already paying for this. We are paying exorbitant amounts for health insurance and not receiving the adequate care for which we are paying. So much of what we are paying into is going into administrative costs, it's going to insurance companies, it's going to pharmaceutical companies, and it's not going to the actual care that we are receiving. We also talked earlier about the administrative costs and what it requires to manage our current healthcare system. Was referenced the hospital in Boston. There are more people in the billing office than there are hospital beds. That seems to me a tremendous amount of waste that we are currently paying for already. So asking about the cost of this, we are already paying in many cases twice as much per patient as what other industrialized nations are paying for this. And so from a cost perspective, this could actually provide cost savings and better care for the people of our country.
Okay. All right. Are there any questions for the bill sponsor at this time? Okay. If not, I'm going to go ahead and close. Oh, I'm sorry, Representative Potter, I'm sorry, I didn't see you.
Thank you, Mr. Chairman, no problem. Not a question, but I'd just like to say one thing. You know, very often when this topic of conversation comes up, the question that you asked is really something that people, and rightly so, question, right? The idea of this is that it would actually save us money. As Representative McGaugh mentioned the administrative costs associated with billing and corporate profits certainly drain the care out of our resources spent on healthcare. But I would also pose the question back to the committee, what does it cost us not to implement a system like this? It costs lives. People literally die because they do not have the ability to afford healthcare. And we are the only industrialized country in the entire world that does not provide healthcare as a human right. We're spending 2 to 3 times as much on our healthcare as every other country. And those figures alone should ask us to ask the question, what's it costing us as is? Thank you.
Thank you for your commentary. Are there any other comments from the committee before we close? Hold on, Rep. McGaw, I'll give you a moment. Rep. Giraldo would like to make a statement.
Thank you, Mr. Chairman. I just want to call to attention something that Rep. Potter had said earlier. Rep. Potter had mentioned that the leading cause for why people go bankrupt in the United States is medical expenses. It's not job loss. It's not poor credit. It's not divorce or separation. It's not unexpected expenses. It's medical bills and medical expenses. And if that isn't troubling and concerning for us and the rest of Rhode Island, then I don't know what to say. But I just wanted to point that out and reemphasize that point because I think it's really, really critical and something that we shouldn't gloss over. Thank you.
Thank you, Representative Giraldo. Representative McGaw, you can go ahead and close out if you would like.
I will leave it with Rep. Giraldo's comments. I appreciate those comments, and I do think that we have a crisis right now. We have too many people that are skipping care, and when we talk about the costs are present in the lack of care and the loss of human life, and we need to consider that.
Thank you, Representative McGaw. And that will close the hearing on House Bill 6078. We have 2 more bills to go. Both are sponsored by myself. I will put them both in play at the same time. I believe they are relative to the same subject. However, we do have different testimony. So, first, House Bill 5850. House Bill 5850, I'm just going to read a brief synopsis. This act would change the name of the doctor of naturotherapy to naturopathic doctor and permit them to administer IVs, perform phlebotomy, and consult but not change patients' prescription medication. That is House Bill 5850. And then we have House Bill 5849. This act would require insurance coverage for healthcare services provided by a naturopathic doctor licensed in the state. We have witnesses for both bills. Is there anyone ready? Okay. Hello, Mr. Carney. This is Chairman Casey from the Health and Human Services Committee. You are here for House Bill 5850 regarding licensing of naturopathy. Go right ahead, sir.
Thank you, Mr. Chairman, members of the committee. My name is Jim Carney. I am tonight representing the Rhode Island Academy of Physician Assistants and the Rhode Island Medical Society. I'm pinch hitting for Steve DeToy. Both of our organizations stand opposed to 5850. What this bill would do is amend the current licensing act for naturopaths. We'd like to point out that this bill was originally, this legislation was, the statute was originally enacted in 2017. And that was after 4 years of a collaborative effort by the Rhode Island Academy of Physician Assistants, the Rhode Island Medical Society, the Rhode Island Association of Naturopathic Physicians, and the committee chairs of the Health Education and Welfare Committee in the House and the Health and Human Services Committee in the Senate. Everyone was in agreement at that time that the legislation that was enacted provided for maximum protection for the public, and at the same time allowed the naturopaths to have a reasonable scope of practice. Now, 4 years later, we have this bill that not only resurrects the contentious issues from 2017 and the years before, but also adds some new issues. I'll be brief. I submitted written testimony, and I know it's getting late, so I'm just going to kind of hit the high points here. First of all, we find that this bill is poorly drafted. There's a lot of conflicting language. There is language, as I point out in my written testimony, that in one part of the current statute is completely counter to what's being proposed by this amendment. One of the major things that we have a concern about is removing the prohibition against using the abbreviation ND. It was felt in 2017, and we have no reason to believe it wouldn't be the same today, that ND was too close to MD, and it was potentially going to be confusing and maybe misleading to patients. So we are opposed to that. The next thing is that this bill would allow naturopaths to perform and administer intravenous therapy. As you see in my written testimony, there's a lot of reasons that we have that we don't think this should be allowed. Primarily because the act of performing intravenous therapy is specifically prohibited by some of the other language. It would run contradictory to both Rhode Island law and federal regulations. The last thing that we have a concern about is that this would add language that would allow naturopaths to perform consultations with patients regarding the use of and safe ways to discontinue prescription medications. Currently, this is, again, a situation where there is language existing in the statute that would contradict this. And the other issue that we have with this is that this has the potential to place the physician, the allopathic or osteopathic physician, in an adversarial position. I mean, it will confuse patients. I mean, if the patient is hearing one story from a naturopath and a different story from their medical or osteopathic physician, who are they going to believe? So I think that it would be best to leave it the way it is and not make any of these changes. I'll be happy to answer any questions.
Okay, thank you for your testimony. Are there any questions from the committee? Okay, so thank you for your testimony, sir.
You're welcome.
Okay. We did have one other witness who wanted to, did sign up for verbal testimony. However, they cannot be reached at this time by phone. That's Christine Healy-Waldeck from the Rhode Island Wellness Society. She's in support of the legislation. She also did, she was the only person to submit written testimony in favor. So without further ado, I'm just going to make a quick commentary that the naturopathy is an alternative is an alternative for people who can't find the right solutions for whatever conditions they have. I do have a friend who had some internal issues and had consulted with many different doctors, could not find any solution to their problem, and now they are being treated successfully by a naturopathic doctor. There is some validity to this legislation, and we'll see if we can make that work out. If there are any other commentaries from the committee, I will take that right now. Representative Donovan.
Thank you, Chairman. You know, sometimes your regular health insurance won't cover things that you need. You're sick and you can't get treatment, and you have nowhere else to go. And naturopathy has been successful for lots of people, and I think especially now when we've been talking all night about insurance coverage and lack of insurance coverage and insurance not covering enough, I think people need alternatives, and naturopathy is a good alternative. Thank you.
Thank you. Are there any other questions from the committee? Go ahead.
Thank you. Very quickly, what kind of training do naturopaths have? This is a new field for me. I don't know.
Yeah, I don't know specifically either, so I think Representative Donovan might have some information on that.
Thank you.
Yeah, a lot of them, they're called doctor, so they have quite an extensive education. And there are schools just like chiropractic, there are schools for this too.
Thank you. Thank you very much. If there are is no other commentary or testimony, I do want to close the hearing on both of those bills. We are going to go back to House Bill 6078. There was a person that we were trying to reach. I'm just trying to verify the phone number is correct. Can you try that number one more time? Correct. Hello, Catherine. Welcome to the House Health and Human Services Committee. You are here to testify on House Bill 6078. I apologize for any confusion, but I wanted to get back to you and make sure you had an opportunity to testify. You have 2 minutes. If you would go right ahead, please.
Oh, thank you, sir. Hi there. My name is Catherine Hillary, and I'm from Newport. I'm here to testify in support of H6078. Thankfully, the federal Medicare for All program now being proposed includes dental coverages. I'm a retired dental hygienist with a buyer beware message for all of you who may find yourselves trusting in the efficacy of large, busy dental offices that accept HMOs and all other insurance plans. These places are like assembly lines where productivity, i.e. patients seen per a given amount of time, comes before actual patient care. I know all about this because my first job was in a place like this, along with many others fresh out of school, including the dentist. The time allotted per patient was not due to the particular treatment alone, but the amount of money the company was able to collect. Those with the best coverages got the most accurate time needed for procedures. HMO patients got the least amount of time because the office could only collect a certain amount per patient per month. Yet all of us had our ethics about us and tried to fulfill our commitments to actual patient care while balancing the productivity protocol of the office. It was very stressful, and corners had to be cut out left and right. The worst part, and I never gave into this, was not spending enough time between patients on disinfecting units. I would never, myself, sit in the chair of one of these offices for this reason alone. For those of us who chose not to cut corners, we were constantly late, and added to that lateness would be having to accommodate patients who were late. The management protocol was not to turn late patients away for the sake of production. Under the stress of this dysfunctional system, with all the rushing and frustration due to lateness, mistakes were not uncommon. I urge you to listen to my buyers beware for the sake of those who may not realize the dysfunction of these kinds of offices, and to support 60878. A single-payer system would allot time per procedure according to patient need and not profit. Time and money spent at the front desks on figuring out patient coverages could be diverted into patient care instead. Thank you so much for calling me back. I appreciate that.
You're welcome, Catherine. Are there any
Thank
questions?
you.
Are there any questions for the witness? Okay, this will close again, House Bill 6078. We have no other bills on our agenda at this time. I'm going to dispense with the committee commentary and just let you know that I truly appreciate all of you sticking with us. We've had some really long committees. We're doing a lot of good work, and I appreciate that very much from my perspective, and Rep. Donovan as well. So with that, I will entertain a motion to adjourn. So moved by Representative Giraldo, seconded by Representative Bia. All in favor? Okay, thank you very much. This has been the Health and Human Services Committee meeting for March 30th, 2021. Have a good evening.